Hi everyone, my name is Katelyn Hedrick and I will be presenting on understanding job demands and organizational resources needed during COVID-19, an analysis of attending physicians and registered nurses. So why should you care about this research? Why is it important? Well, in 2017, there were over 3.8 million nurses in the United States. However, despite making up such a large percentage of the healthcare industry, to our knowledge, there's very little research on how to best help them during times of crisis. So it's our hope that we can help begin to bridge this gap. To do so, we decided to look at whether or not there were shared and or different job demands reported by attending physicians and nurses, as well as if there were shared and or different organizational resources requested by these two populations. And if so, what were they? To do this, we use an adaptive survey technique on the open-ended qualitative questions where we looked at previous rounds of data and met with hospital leadership in order to understand what's going on in the clinical work environment currently and adapted the survey accordingly. Attending physicians were invited in March of 2020, while registered nurses were invited in July of 2020. And to analyze this data, we use an iterative coding scheme. So in short, our results suggest that there are both shared and different job demands and organizational resources. The graphs in the middle represent the job demands, with the upper graph demonstrating those that are shared and the lower graph demonstrating those that are different. These graphs were created by using our frequencies from our coding scheme and dividing that by the total number of responses for that role. So specifically, what are our results? Well, the shared job demands are things such as staffing shortages, bed holds, and schedule issues, while the different job demands are things such as supply shortages and contract changes. Shared organizational resources consist of requesting additional information or wanting more information about what's going on, as well as the different organizational resources are things like additional compensation, leadership visibility and presence in the ED, as well as education and training. So like I previously said, it's really our hope that this can help begin to bridge the gap in how we can best help nurses and potentially spark future research on interventions that could be targeted towards these populations in times of crisis. Thank you so much for listening.